Today we're going to be focusing on COVID-19 ongoing management and control, with a particular focus towards food safety and hospitality compliance. So just for the ground rules and rules of engagement for today, this session will be recorded. Rachel will be starting that very shortly if she hasn't already, for later review, and our previous events are on the SOFHT website if you wish to focus on those. So I should have introduced myself. I'm Peter Littleton, current SOFHT chair. So I'll be chairing this a little bit and then handing over to Alan Lacey for the Q&A in a short while. If you could please remain on mute unless you're asking a specific question. And as many people have already found, if you are struggling with connection, if your Wi-Fi is a bit laggy, then switching off your camera will certainly help to ease the session for you. And there is, if you've used Teams before, a chat function. So if you wish to submit questions at any time but are a bit shy or don't want to break in to the flow of conversation, then please feel free to submit it through the chat function, and then we'll pose the question for you. So if you've been to one of these soft focus sessions before, you know we like to keep a fairly informal ship. So it's an informal discussion led by a team of very experienced food safety professionals in this realm, and we're going to look at the facility layout, ordering, table service, staff movement, and customer expectations during this. We're also delighted to have an enforcement perspective and a discussion of the schemes that have either been developed or are in development to comply with COVID-19 controls. So, ladies first, one of our speakers today is Carol Stewart, a safety and food hygiene consultant for Burger King and Birmingham Airport, amongst others. We have Rob Easton, a chartered environmental health professional from the Shield Safety Group, and Paul Hobbs, Principal Environmental Health Officer for Horsham District Council. Alan, just correct me, have I got the right names in the right places for our speakers?
I think so. It's just, Carol, you've moved from Manchester to Birmingham. I'm sure she would have corrected you on that.
Apologies, I'd written down.
It's all the same. It's all the same. It's not London. Doesn't matter.
The big murky northern cities, yeah.
Well, being as how I'm currently sitting in office in Warrington, Carol, I should be quite familiar with Birmingham Airport, Manchester Airport, I should say. So yeah, right. So I will hand over to our team, and I will put myself on mute. So look forward to the discussion this afternoon.
Okay, so just to start off, can we start with you, Carol, just to give you an overview of how you see things are at the moment, any challenges that you've been aware of, and then if we could have a similar perspective from Rob, and then we'll go over to Paul to give the enforcement viewpoint, if that's okay.
Yeah, no problem. So, yeah, Burger King, I think out of all of the food service companies, we were out of the traps fairly early on once we were allowed to reopen. So, and we did it in 4 stages. And just to recap, the company I work for is called BK UK. So we're not the brand owners, who are called RBI, Restaurant Brands International, and they own Tim Hortons and Popeye's Chicken and Burger King are the 3 brands. So a lot of our standards are controlled globally. So the company I work for, we own the brand in the UK. So there's 550 restaurants, of which about 150 are managed. So what we did, we were really out of the traps very early on, and we started with our own restaurants, and we went through 4 stages that were tested in our restaurants, then rolled out to our franchisees. So we started out with just the drive-through business, which was astonishing after lockdown, how long people were prepared to queue up to get a Whopper. And, you know, literally people were happy to sit an hour and a half, 2 hours in a queue. Our area managers couldn't believe it. And also how patient people were as well, because, you know, it had been 2 months since anyone had had any fast food. So then we extended the drive-through to home delivery with our home delivery partners. Then the next big step was takeaway. So allowing customers in, not to dine in, but to collect food and take it away. And then when the rules relaxed and the 2 meters went down to 1 meters for social distancing, that's when we opened the dine in. So it's been a real roller coaster, and we put our standards together with our primary authority, who have been remarkable and fantastic. It's a very, very old partnership. It was one of the very first ones when there was Home Authority and Lead Authority. So they've kind of got Slough Borough Council, they've kind of got Burger King going through their DNA, but they've been immensely helpful. So we've done it really with 4 main documents. So a playbook, everyone's got an operations playbook these days, haven't they? So ours is 189 pages. We're not proud of that. So one of the next jobs is just to try and simplify everything, because at the beginning there was so much to think about, and it was so different size restaurants, different styles, different footprints of restaurants, to try and cover all the permeabilities, all the different, not the permeabilities, all the permutations, was quite difficult. So we had a playbook supported by a risk assessment that we'd written with Slough Borough Council, and then 2 other pretty key documents. One was all about fitness to work and all the various situations that might come up, you know, employees, customers, are they a confirmed case, are they a contact of a case, when can they work, when have they got to self-isolate, and also the track and trace policy most recently. So it was kind of chaos, not chaos, it was organised chaos, managed chaos at the beginning, and we were all working till God knows what time in the evening. But it feels like it's really, really calmed down, and it feels like what we've done has really kind of started to work and hit the spot, and people are starting to feel confident of the controls that we've got in place now. And I think the bit that most people are nervous about at the moment from our point of view is well, customers seem to have adapted to the new normal really quickly. So when we started dining, we had a door marshal, and we also had 2 people marshalling the dining room area to communicate with customers and keep them separate from delivery drivers and all those sorts of things. But we were able to drop those numbers fairly quickly because the customers adapted remarkably well and remarkably quickly, which was a big plus for us. So I think the thing that people are most concerned about at the moment is the test and trace procedure, as that's ramping up and the government are doing more testing and tracing, the effect that that might have. And of course, as probably most of you know, the 4 countries that make up the UK, there's 4 different sets of rules, and Scotland and Wales made it mandatory, and the duty is on the business as of last Friday to capture and record the customer contact details, which in effect means if they won't give their details before dining in, you can't serve them, you have to refuse service. So that's kind of up the ante quite a bit. We're only 3 days in on that one yet, so I've not had too much feedback about that. But I know we've set up our system as a QR code that people scan on the phones, and it takes them to a Google form which they fill out. And we've had something like we've had 30,000 responses so far, and we're getting about 1,500 a day, which is probably not the amount of dine-in diners we've got. And certainly in England and Northern Ireland, where it's not compulsory, we're finding probably only about 10 to 20% of people are wanting to do that. So it'll be interesting to see what the mandatory status does to the situation in Scotland and Wales. So anecdotally, from some colleagues working in other companies, I think people are quite concerned about the rules that test and trace are being applied, about inconsistencies. So we've heard tales this week of a Welsh local authority insisting on no digital system. It had to be a book that you wrote down people's contact details in. And we've also heard anecdotal tales in Scotland where the tricky business as to what's a close contact, which we have sort of decided is it's less than between 1 and 2, well, it's less than 1 metre, isn't it? But the 1 to 2 metres is the difficult one, because with mitigation and less than 15 minutes, you're not a close contact. But anecdotally, we've heard of a few instances where there's been a confirmed case in a restaurant and the officers have said, well, irrespective of what your controls are, everyone's got to self-isolate. I know that's not happening everywhere, and some people have had some good experiences where officers have come in and said, yeah, we're happy with your mitigations, so where you've gone less than 2 metres. But I think there's still a bit of inconsistency of enforcement out there. And it'd be interesting really to hear what Paul's got to say. I was reading some guidance yesterday about the difference between a direct contact and a proximity contact, which is a newish phrase to me, really, to sort of understand how they're differentiating between those two. But one of the things we have done just to help our restaurants if they get a visit is we have we've created a mitigations table so that if they get any questions or challenges about areas where the social distancing is less than 2 metres but more than one with mitigation, and I'm going to hold this up to the camera because it's the easiest way to explain it. Basically, we've got a table here. So down the left-hand side is the people who may be affected. So front of house visitors, back of house visitors, drive-through guests. And then along the top, we've got a load of mitigations, those that cover front of house, so customers and people who are in the public areas, and then our back of house mitigations as well. And that was something that we came up with our primary authority, because we thought the whole playbook, 189 pages of new rules and operations, is quite complex. So this is just kind of summarising for them on one page the main controls we've got in place for social distancing, just for them to be able to talk any enforcement officers through. On the whole, we've had 1 or 2 queries from enforcement officers. Some local authorities have been really great contacting us about shopping centres, moving customers around in the streets, so to speak. And so on the whole, we've not had any challenges we wouldn't be happy with. But again, that's where our primary authority partnership would really come into its own, that we would hopefully get their assistance if we were being challenged on something we thought we were complying with. So,
Carol, thanks. So I was just going to say there, you mentioned that the customers had adapted to the new norm, for want of a better phrase. I've had a lot of feedback from retail business, and retailers are finding immense hostility towards their colleagues in all sorts of things, asking them to wear masks and distancing and so on. But that hasn't been your experience in the restaurant.
No, it hasn't, but it's very different in QSR, because they're either queuing up and they get the food and off they go, or they're coming in, getting the food and going and sitting down at a table. So, I mean, I've experienced this in supermarkets, because people just want to shop as normal, don't they? And customers are leaning over you to reach something you're stood in front of and taking exception. But on the whole, touch wood, we've had no nasty incidents from customers at all, quite frankly. So
it's good.
Touching wood, of course, but so far so good.
Good. I mean, the other thing that Carol and I have shared some information from colleagues around the food business, and it seems that a lot of the local authority or enforcement contacts have been as a result of customer complaints. And perhaps we can discuss that a bit when we go on to Paul later on. But can we move over to you, Rob, and give your perspective? I know you've been doing a lot of work with some of your client companies on this.
Yeah, absolutely. So just to give a brief overview, our client base ranges from very large supermarkets. So Tesco's is one of our clients, through the pub, hotel groups, chains, many high street names, down to individual entrepreneurs. So we've been supporting with the very, very largest, right down to the individual trying to reopen their business. And it's been an interesting time for us. We were helping them to close their businesses down safely, which of course was tough for everyone. How to maintain the safety when they were closed, and then actually the pleasure of being able to reopen these units again and see the businesses trying to get back to some normal. It's interesting. There's a couple of points that Carol mentioned that I'll pick up on. One of them was around the bubbles, the mitigating action, and it's really interesting. One of the we work with Food Standards Scotland, and what they're finding from their outbreaks is actually the value of bubbles in the workplace. So if you can demonstrate these groups, if you can demonstrate the mitigating action, the impact on the business is considerably reduced. Also, one of the things that they're feeding back on is a lot of work's done on front of house where the guest can see it. The customer journey is really well mapped, and it's been fantastic working with some of our clients, and the really good ones have mapped the guest experience alongside safety at last. I've only been trying to do it for 20 years, but we've been mapping the guest journey with them and how you deliver that hospitality in an inhospitable time. That's been a challenge. But it's the back of house stuff. So it's where team are meeting. It's when they are going for the cigarette break. It is when they're having their lunch together. And actually, a lot of the outbreaks are going, yeah, front of house, fantastic, but just think about the back of house as much. So that's what we're learning, and then we're passing on to our clients. If we look at challenges, I've got a number. Carol, again, you mentioned dealing with Scotland, Wales, England. We support clients across all of the devolved nations. And trying to keep up is a challenge in itself, just the nuances, the individual countries. Thankfully, we feel that that's slowing slightly. The guiding principles remain the same. there is an alignment coming, but it is a challenge. So if that's a challenge for us, and we're supporting many businesses, I feel for those businesses on their own trying to operate in those areas. Other challenges, I just look at my experiences of dining out recently, and I was out on Tuesday night making the most of the 50% off, and it dawned on me that, again, we have fantastic policies, we're writing fantastic procedures, but as is often with safety, it comes down where the rubber meets the road. It's about what's operating at a restaurant or store level, and we are reliant upon, inexperienced people may not understand the why, and if we're going to see any sort of impact, is making sure that day in, day out, the controls are in place. And my experience, as I say, just on Tuesday night, was that wasn't happening. You had people operating in the restaurants who just weren't putting in the COVID secure measures that we would expect of them. Other challenges, I think for the hospitality industry generally, we obviously support a lot of pub restaurants. They have the pleasure, the luxury of beer gardens at the moment, and how are we going to move these people inside? So, and how does a business maintain being viable when the covers are going to reduce? And those businesses we know outside of, we talk about the London villages where they've got the pub beer gardens, have been able to trade. But what does that look like when it's hooning it down and you haven't got room for a marquee or any restrictions that go with that? But also with it, we see a lot of opportunities. We've done some research with consumers, and the interest in the food hygiene rating scheme is huge, is massively increased, because they see that as a proxy for management commitment to safety. So therefore, I think there's an opportunity there where we can increase people's interest in safety. And again, the research that we've undertaken is consumers are interested in health and safety and food safety like never before. And if one last thing, that I'm always an optimist, you'll probably pick this up, is for once and for all, maybe, just maybe, we've got people washing their hands properly. If nothing else, can we take that out of it and maintain hand hygiene moving forward? So I hope that answers your question, and more than happy to share our experiences.
Thank you, Rob. I see Rob from Nando's has flagged up a comment there that their customers haven't been quite as understanding as yours, Carol. I don't know if that says anything about Rob's customer base, but don't explore that too far. It's quite interesting. I think probably people are more interested in a half-price meal at the moment than they are on social distancing. But can we, before we sort of open it up to discussion, Paul, thanks for joining us once again. Paul is the primary authority contact for the Society. And I think what's been really nice, Paul, in the last couple of weeks is the really positive comments that we've heard around our networking group about the value of a primary authority relationship when COVID measures have been discussed. So would you like to give us your perspective on things at the moment?
Well, from a primary authority point of view,
yes,
yeah, well, we've got 11 partners now in Horsham, and all but one of them have come to us asking for specific advice on COVID, or asking us to look at documentation that they put together to see whether or not, from an enforcement point of view, whether it would be acceptable. So, bearing in mind that those are a couple of coordinated partnerships which have several thousand or 100 members, that advice is going out to an awful lot of businesses throughout the UK. And the feedback we're getting from other enforcement colleagues is very positive. So from a primary authority point of view, it is demonstrating that as a tool, it is effective. It is effective at communicating with the businesses, and it's effective in getting a level of consistency, really, because generally, if the business knows that the primary authority are happy with what's been developed, they relay that to their enforcement officers, who then take that on board. So from a practical tool, it's been really, really beneficial, definitely.
Good. And does your experience match what we've discussed earlier, that a lot of, or much of the enforcement activity has been as a result of customer complaints directly to the local authority? Yeah,
absolutely. We have seen an unprecedented number of complaints in recent weeks. And we're also getting complaints from businesses complaining about other businesses, which is quite unusual. And the expectation from a lot of the public is that they when they go into somewhere to dine or to drink, they're expecting it to be almost a sterile environment, and they panic when they see that people are in close contact, when they see people not wearing face masks, not washing hands, and we do get we have been getting an awful lot of complaints, which obviously we have a statutory duty to respond to. So that is taking up a fair amount of our resource at the moment, dealing with complete complaints solely on their own.
So I think one of the things that I found quite interesting is that when there was discussion about restaurants opening up again, and we saw some examples, I think, in Scandinavia, where dining tables would be surrounded by a perspex screen. I know some of the multi-site companies here had those sorts of discussions, and I personally haven't seen or heard of any of those sorts of situations arising. And maybe customers had been given the expectation that they would be sitting in a little plastic cubicle when they went out to eat. I don't think that would do very much for the general experience, but maybe that's where that stems from. Were you aware, or is anyone aware of those sorts of situations where tables are screened off from one another?
Not an entire screen. There are some places where I've seen almost a pull-up banner type screen separating tables, but I've not yet come across anything that is completely enclosed with a perspex screen. No.
Because there was a lot of discussion, wasn't there, originally, that was the answer to getting restaurants open again, that they would have to install these screens. And I know they did it overseas in some places. Did you have any discussion about that, Carol?
We didn't know, and to be honest, we've been fairly minimal on the screens. We've relied on mitigating factors, and if we can't control the risk from that, that's when we've gone for screens. One of the key areas where we're putting them in, though, is induction training of new employees, because it's very difficult to train someone and be stood side by side with them from a distance, showing them how to assemble a product on a production line. But yeah, as far as customers go, we have done some work in our booth seating whereby there was a partition, but it was slatted. So we've put a little bit of acrylic on to block up the slats, so we wouldn't have to use every other booth, so we could keep them in use. But that's about as far as we've gone. Though I did see there was a hilarious bloke on the news right at the beginning who ran a pub in Wales, and what he'd done is he put up plastic shower curtains with rails around every table, and that was his solution to it, which was, you just think they're just going to be in an unspeakable state after a couple of weeks.
Yeah, but it's Wales. There's Rob Belton is with us. Hi, Rob. Rob's put a question up here about the use by businesses of pavement licenses so that they have more outdoor eating space. I know it's been a boon where pubs have beer gardens, but Paul, are you aware of any restaurants, cafes moving towards that, using pavement areas where they can?
Yeah. When there was a relaxation in the legislation, we were expecting an influx of applications, and that hasn't really happened. We've probably had about a dozen restaurants, mostly in the Horsham town centre, who have come to us wanting to put out tables and chairs. The one thing I was interested what Rob mentioned about pubs putting marquees up in their gardens. Because one of the issues that we're having now is our planning department are coming to us and saying that various licensed premises are putting marquees up in the gardens, and because they're exceeding the 28-day restriction, they have to actually apply for planning permission to have the marquees up all year round. So that's another area where we're now consulting with our planning colleagues on the impact on neighbouring residents of a marquee in a pub garden, especially where the pub wants to have live events in the marquee. So it's generating lots of work in areas we didn't really expect.
One would hope that, you know, if there's no live music involved, if it's just there for extra seating space, that planning would be a little bit understanding about that, shall we say. But who knows? It depends on the location, I suppose. Okay, can we open it up? Rob from Nando's has put another comment up here that they have put additional screening in where it sits comfortably with the design. So I suppose that's the answer to it, isn't it? If there's a situation where the restaurant's divided up into booths to a certain extent anyway, that's a fairly straightforward addition. Is there anyone else online that wants to raise a question to any of the panelists? No, very quiet, very quiet.
Alan, can I just pick up on a point from Paul?
Yeah, sure.
It was interesting when you were saying about planning, neighbourhood nuisance. Again, those that have worked within environmental health, we know that environmental health and other parts of the council can be used by, I've got to be careful here, by residents if they have, there may be a genuine concern about a business, but it's also a way to air gripes, and yeah, the council can be used in that way. And it's just a fact, and we recognise that. Something we talked about early on with many of the clients that we supported was recognise that COVID could be another thing. So we're used to people making noise complaints, you know, environmental protection, allegations of food poisoning, you know, general antisocial behaviour. And what we're saying is just be very aware that the COVID controls could be another route that a member of the public, if they've exhausted planning, if they've exhausted the normal environmental health noise nuisance, it's another way to have a dig. You know, and that was really important to that, because businesses, they're saying, well, we're doing everything we think we can. And what we're saying is you have to be very visual with that. You know, the signage has to be in place. The team have to be seen to be taking action. And because you have the mobile phone warriors out there taking the videos, taking their photos, and absolutely, if there's reason to complain, you know, absolutely and justified, but it's actually using COVID as a tool against a business. So we did a lot of work coaching, particularly pubs, on how to be wary of that.
Of course, yeah, thank you. Just to turn it around a bit, I think it was you, Rob, that spoke earlier about colleagues and taking breaks and so on. But in your experience, and Carol, you'll have some comments on this as well, I guess, the reaction of colleagues working in food service environments and getting back to work, have they been particularly nervous, or are they reassured by what's being done by the companies?
Do you want to go first, Rob?
If you have, yeah, I'll try and make it quick. It's not a trait of mine, but I'll try. What we're seeing, and again, because my background is hospitality as well as environmental health, so I've still got a lot of friends in the industry and operations. And yes, team are returning. They're looking for reassurance, and the Safe to Trade scheme that we operate is about as much reassuring the colleagues as well as the guests, because without the colleagues working, you've got no guests there. So team are returning, but I think what will be interesting is when hospitality rebounds, when the job market becomes a little bit more secure, is where these employees then choose to go. You know, if they've had a bad experience with an employee, if they haven't felt looked after, now they might tolerate it because, you know, something's got to pay the rent. But in the future, I believe it's those employers that have shown to be most caring about their team, thought about their welfare, thought about their COVID safety, and they'll become the employers of choice. So I think for the moment, you're not going to see a huge movement because, you know, that's the reality of life. They've got to be earning money. But I think the future is where they then choose to take their trade and take their skills.
Yeah. Carol?
I think in Burger King, they did manage it very well because what we did was every single employee, before they returned to work, they had like a half-hour interview one-to-one with one of the management team from their restaurant, explaining what we were doing, how we were opening, how we were reducing the menu, and all the enhanced processes we were putting in place to try and control the risks. And then on the first day back, before they started work, there was an induction training session that they had to do with each employee. The other thing that they do seem to quite like is, and it's an RBI thing, not us, and this is all things that we've agonised over and that have changed, like taking people's temperatures, to wear a mask or not to wear a mask. RBI, being an American company, and as we all know, kind of they see hygiene very differently over there. So the obvious example being everyone gloves up in America, don't they? Whereas we're less keen over here. So we started, as soon as we opened, employee temperature testing, and everybody has to wear a face covering. So I think kind of because they went in with quite a high standard compared with other places, and now, like, turning around the RMS Titanic, it's kind of like the face masks are becoming more ubiquitous. If we have a second wave, the temperature checking will become more ubiquitous. But I think that because they did a very structured return to work, I think that helped. But the thing that has that we've had employee concerns about is masks. They bloody hate wearing them. Everybody, I mean, they make my glasses steam up, no matter even if they've got the nose strip. So we've had, queries about people with medical issues, but we've had to put in quite a strict policy, because we think if one person is allowed to not wear a mask, everybody will go, oh, I suffer from claustrophobia, distress. We need to sort of like have a fairly rigid policy on it. So we've gone down that if your doctor says you don't need to, we'll offer them a different face covering, a visor. And if the doctor says they cannot wear anything, only under those circumstances can they not wear any kind of mask or face covering, because we know they all hate it so much they would leap at the opportunity not to wear them. So
I was talking to Peter earlier on this morning, and I said that I was astounded on making a couple of journeys around London and the suburbs, just how many people were not wearing masks on public transport.
Really?
Yeah. It's signs everywhere saying it's absolutely mandatory, but lots of people just getting on with this sort of fixed expression that says, do you dare challenge me? But do you think, and this is something I'd throw out to everybody there, do you think because we've had so many conflicting, arguably confusing messages through the media, people are getting more complacent about the situation, and might argue that there's not that many cases anyway, so why should we bother? Has that been an experience with you, Rob or Carol?
I'm not too sure, but I had some interesting feedback with a friend who's a nursing sister. So she's an ex-critical care works in Blackpool and Darwin, and she was saying this is one of the hot spots where they've got loads and loads of cases, but they've only had one person in critical care. So again, this is all anecdotal, but their feeling, she said, in the NHS is that the people who are getting it at the moment, somehow or other, it seems to be less severe and seems to be putting fewer people into critical care. So that was an interesting fact. But the other thing she said was that the number of premature births, the premature baby birth rate, has gone through the floor. And nobody knows why, but one of the working hypotheses, to come back to what Bob was saying, Rob, over familiar, earlier, about they think that maybe one of the main causes for premature births is a hygiene, that it's infection that's causing it. And because of all this sort of hand washing and social distancing, that might be sort of one of the unintended consequences of coronavirus, which is probably the only good thing that's come out of it.
That's really interesting. Rob, how about you? Any comments on that?
It's difficult because, again, anecdotally, you hear people say, "Well, I'm all right, Jack. My boots don't leak. No one's been impacted." I'm based down here in Dorset, and our rates are very low indeed. So it is hard because our experience here is we're not seeing COVID-19. We're not seeing the cases. What I do know, though, is businesses still see having rigid controls in place as I wouldn't even say a competitive advantage. They're truly a hygiene factor. And they will continue to implement this because consumers are saying, actually, we're not going to visit unless they can demonstrate high standards. I read this morning just on the Eat Out to Help Out scheme that half of those that have not followed the scheme have said they don't feel safe going out yet, that they don't think restaurants are operating at a high enough standard. So I think if you want to see consumers return to restaurants, return to the high street, they're going to want that reassurance. They're going to want to see the very visible controls. Like I say, that's the experience with our clients, saying that they want to do it because they want to invite people back safely. But just behaviour is saying when they're not going out, is safety still a concern?
Thank you. Rob Kitchen, you raise your hand there. Is there a question that you want to put? Rob, are you with us? No?
Oh yeah, sorry, I forgot the mute button. That's that is one of the new catchphrases, isn't it, of COVID?
Yeah.
So yeah, what I'm interested in, Alan, is that we had our first sort of major outbreak involving staff members last week, and as it was up in the northwest where PHE and I think the local authorities are pretty much in the thick of it, it escalated to an outbreak control meeting fairly quickly. One of the things I think which is really interested, and I have to say I hadn't fully appreciated, is that the PHE guidelines on a close contact does include people who are working in a COVID secure workplace in a number of circumstances. So in particular, where you use mitigation behind a cook line and you rely on either back-to-back or side-by-side working, that does not eliminate those workers from being contacts if one of those people tests positive. And the consequence of that is you, from a single case, you can end up losing a fairly significant number of people out of your team very quickly. And to me, that's, you know, in one sense, it's absolute practical confirmation that the hierarchy of controls does what it says on the tin, and that if you reduce the risk, it's not the same as eliminating it. And PHE are clearly coming from an elimination perspective, whereas the workplace guidance is coming from a reduction perspective. But I was just wondering whether other businesses or other people on the call had engaged with that maybe more proactively than I had, and other than bubbling, had any practical suggestions for how to minimise impact when actually somebody does come down as being positive.
Anyone want to chip in on that?
Well, I suppose from my point of view, in Horsham, we've touched wood. We've not really had what you would call an outbreak yet, so we've not sort of experienced that at all. But our neighbouring council, Crawley, did have an issue with a premises that they requested to close because a number of employees there were had tested positive. And what happened there was that those employees that had tested positive were asked to isolate. The rest of the employees were asked to get a test, and the premises was asked to close for 24 hours to do a deep clean, which afterwards they were allowed to reopen. So whether that's consistent with what is happening in other parts of the country or not, I really don't know.
There's just a question here from Paul Keogh on Carol's point on proximity when people are seated. Paul said that his experience of restaurants near him, that they're recording table numbers along with names for track and trace. And they plan to highlight potential separation or proximity should confirmed cases be identified. Do you think that's being enforced differently by different local authorities? I think that is what's your view on that, Carol? Do you think that's an unusual response?
It's the nebulous nature of 4 different sets of guidance, isn't it? So, because that's not a legal requirement anywhere, but all the guidance for all the 4 countries says if you can identify a table number, then do. So in QSR, the industry I'm in, we're not doing because our tables aren't numbered, and it's such a fast turnaround anyway. But I suppose I think what they were saying is if you've already got a booking system which can accommodate that, so then that's a good level to have. So I think it would depend on your existing systems whether you'd be able to do that. The difficulty is, of course, though, sort of in a pub, unless you've got a dedicated server at one table, it's, you know, even if you've got the table number, it's going to implicate anyone potentially walking past. If the proximity rule is going to be applied, that would mean that just proximity means you would need to self-isolate, even if it was a fairly brief passing contact.
Okay.
Alan, I was just going to say, where we're supporting clients, we're saying absolutely there's the minimal requirements for maintaining guest details, but the investment in understanding where your servers have been working, what tables they've been supporting, where guests have been sat at. We know it's like the old recall is, you know, as the more finite the data is, then the impact on the business will be lessened. If you're going to do it very vague, then guess what? It's going to cover a lot of people. So our experience is those pub restaurant operators we support are taking further details because they want to close down the impact as much as possible. And just following up a point about close proximity working in kitchens, again, one of the clients we worked with very early on, we looked at, again, they were fantastic because they realised they weren't going to be able to do what they did before they closed. So it's that realisation actually that the guest offering, the guest experience has to change. And what we looked at supporting them was looking at the food offering, so therefore they could reduce number of people down in the kitchen to deliver it safely, consistency, and of the quality demanded. But then you could work in bubbles, you know. So if you can bring it down to 3 chefs in the kitchen, and they effectively work a lunch and an evening, then the next day lunch and an evening, they were able to do that. So then you're bringing in some redundancy into the organisation. You've got that safety margin. But it was great working with them because they realised they had to start with understanding the product or offering to then be able to resource and put the capabilities in to meet it.
Okay, thank you. Just one thing that occurred to me when I've been into a couple of restaurants, and the whole issue of taking temperatures of customers as they walk in. Any views on the real value of that and the accuracy of those devices they're using, presumably handled by people that don't have a lot of experience in taking people's temperatures?
I must admit, I have questioned it myself. You know, what is the point? And I sometimes wonder whether it's part of the guest experience. So if they're having their temperature taken, it sort of like relaxes them a bit more and makes them a little bit more confident about eating there. But I've not asked yet, but I would like to know what would happen if someone took someone's temperature and it recorded 40 degrees centigrade or something. You know, what would they do then? Would they, would they refuse to serve the person, turn them away, or what would they do?
Yeah, we're only temperature checking employees and other visitors like contractors and delivery men. But essentially, if it goes above a figure, which I think is something like about 37.8, then they are indeed. It's like rest for 5 minutes and do it again in case they were just having a bit of a hot flush or something. And then if it fails the second time, then they're told they can't come in. And what we have said is that it's got to be a medical device, the thermometer that they use, not just like any old infrared gun you point at people. So, and we're not doing customers, and I'm not aware of any other restaurants doing customers, but you know, maybe it's another one of those, another U-turn waiting to happen.
I have had my temperature taken as the customer.
Where at?
I can tell you, if I'd been waiting for 2.5 hours for a table, as some people are waiting for tables for mine, it might have been a difficult conversation if they'd excluded me.
Yeah.
I'll share a very brief experience. I had to go to the dentist, and they said we'll take your temperature, Rob. It's part of the requirements. They said, but it is 32 degrees C. It was a sunny day down here on the south coast, and they said, so if you can stay in your car as long as possible with the air conditioning turned down to as low as you can, you'll be fine. You'll be grand. So I thought it served absolutely no purpose, and probably quite frankly, they probably thought I was half dead by the time I turned up. So it'd been like in a walk-in chiller for half an hour. So I'm afraid, for the reasons it can be easily cheated, it can be easily false readings, and also just the high level of asymptomatic carriers. And my concern, and Paul, you touched on it, about people feeling it's more hospitable, they can be more relaxed, then does that give a false sense? Yeah. If they're feeling more relaxed and actually, we've all had our temperature taken, so we're all good in here. And that is a genuine concern that I have, is that you want I don't want to use the word fear, but almost a precaution amongst your visitors and your team that someone could be carrying coronavirus. So if everyone in there thinks they're okay, then does that go out the window?
I know. I've had a couple of independent restaurants, but one chain restaurant, a guy was standing about 6 or 7 foot away from me and sort of waved this gun, and I sort of said, is it going to work from there? And he said, well, it'll check whether you're dead or alive, which was Karen Goodburn is on with us today. Hi, Karen. And she's made the comment that there's no clear value in taking temperatures of people, but it makes people feel better. And Jackie, poor Jackie Healing, come on, had a temperature check at the hairdressers and was sent home.
Sent home with roots.
I gave you another reply with Jackie later on.
Oh dear.
Any other comments from anybody?
Yeah, just one. I wrote it down and I meant to say earlier. So a friend who works in local government sent me some PHE guidance, and essentially what they're saying now, where someone is a contact and would need to be self-isolated, is if they're a direct contact, which means you've been closer than a metre for more than 1 minute, and the proximity contact means that you've been within 1 to 2 metres for more than 15 minutes. So we've got a distance 1 to 2 metres, more than 15 minutes, but it doesn't say anything about mitigating factors. So to what Rob Kitchen said, obviously mitigating factors are out the window. And also, I think the other one is it doesn't say whether the 15 minutes is a waitress walking past you between 1 and 2 metres, like several times, and it adds up to 15 minutes, or if it's one single period of 15 minutes. The conversation I had with our local authority on this whole business about the 15 minutes for close contact was it would need to be a single block of time, not adding up all the bits throughout an employee's shift or a customer's visit, because otherwise, how would you do it? It would just be impractical.
Yeah. Okay, thanks everybody. We're coming up to the end of sessions. Any other comments or questions for our guests before we start winding up? No? Any final comments from Carol, Rob or Paul?
No, I think for me it's been quite a bonding experience for us in operations, because it's sort of so many people coming together and producing all these changes in policy. So it's been a very good work experience, I think, if a bit stressful right at the peak when we didn't know if we were getting it right, if you know what I mean, when it was all new. So so from that point of view, it's been a good experience. But yeah, I think we're kind of like, what is the new normal going to be? Is there going to be a second wave? Are going to be our major concerns in the next few weeks?
Yeah, I hark on to something that Rob talked about right at the start. It's a shame that it took a pandemic to re-emphasise the importance of hand washing, particularly amongst food handlers. But the other thing that has come out of it is that businesses now are showing an interest in risk assessment, which is something that they put on the back burner for many years after the HSC had told us we couldn't go out doing inspections anymore. So, some businesses are saying, are asking the question, what is a risk assessment? That some good has come out of it from that point of view.
Great. Go on. Sorry.
I was just going to say, if we're talking sort of silver lining stuff, for me, it's the acceleration of tech in these businesses. For those that have been in operations for any length of time, how long have we been trying to get order at the table apps, pay at the table apps? We've always looked at it from the guest experience side of it speeds up the paying process. But actually, that technology has been sat there for years, and that's coming to the fore. And I think that's fantastic, because on the back of that, we can piggyback allergen management, allergen data. And there's lots of businesses that we work with that, quite frankly, were maybe 10 years behind on adopting tech. They are now at least up to speed, and the good ones are, they're roaring away with it. So I think that acceleration of tech is fantastic, and it's probably moved us on, 5-7 years. And that has to be good for the guest experience, but I think it's also great for safety practitioners.
Good. Well, this is going to be with us for a while, and no doubt it will be a subject for us to review maybe in a few weeks if our panelists would perhaps like to join us again. Thanks to everybody. Back over to you, Peter, to close.
Yeah, just to reiterate there, thanks very much. It's been a really fascinating fascinating discussion. I'd echo Alan's points about I had a day in central London yesterday, and I found myself at 12:30 at lunchtime on Holborn Station on the Piccadilly line, wondering if I'd missed a close sign because there was nobody else on the damn platform. And the number of people who seem to get on the tube and then take their face coverings off, and you think you're missing the point.
Yeah.
On the plus side, the food services and food retail sector did seem to be doing very well with the Eat Out scheme. So thank you very much to Carol, Rob, and to Paul for their insights today. And of course, thank you very much to all the people who submitted questions, and thank you very much for attending. If you want to stay in contact with SOFHT through our website, through our LinkedIn pages, we'll be advertising the next subject for SOFHT Focus Live in the coming week or so, as well as the panel. So if I could just say again, thank you all very much to our panelists. Thanks everybody for attending. And have a very good afternoon, and keep washing those hands.
Thanks, Peter. Bye-bye.
Thank you.
Thanks. Bye.
Cool.